Welcome back to the Women's Forum. Today is a very special day focusing on women for health. I'm Shelley Chopra, the founder of She the People TV, coming to you live from Delhi in India. She the People is India's largest women's platform, reaching 400 million a year. But every single day, women interact with us talking about how difficult the struggle to equal access of health is. Every single day, women ask, what is it that will help them get access from government, policy tables, discussions and forums to put women's health at the top of the burner? Healthy women will clearly make healthy economies. And we are coming out of a challenge, which is this mega pandemic. How do we make this recovery, the she recovery that Women's Forum talks about every single day, more resilient, more meaningful, if we don't start fixing what's broke? If we don't really start putting women's health as a priority in not just discussions, but also on policy tables. Today is going to be a really powerful day because we are finally dedicating an entire set of sessions at the Women's Forum on women's health. Who better than taking us through what to expect than the founder of the Women's Forum, Audrey Sherkoff. Audrey, it's over to you.
Thank you, Shelley. It's an honor for us to welcome you today for this special and important discussion on women's health. The issue is crucial, like you said, and should be at the core of our efforts to achieve an equal future for all. And we know that women's life expectancy is higher than men's, 5 years on average in the G20 countries. But this also means that they live several years in poor health. And furthermore, more than 1 in 3 women in the G20 consider that women-specific health problems are not effectively addressed, again, in the G20 countries. So why is that? Because during their entire lives, women face health challenges, which are widely under-researched and under-supported as well by both governments and businesses. From sexual and reproductive health to mental health issues and specific health problem. It's an absolute priority to invest and to commit to improving women's health. Enhancing access to health is crucial in tackling persistent gender inequalities. The issue is more prevalent than ever in the context of the pandemic that have worsened pre-existing situation. It prevented women from adequately taking care of their health due to a lack of time, obviously, increased care work, as well as reduced capacity in hospitals. So I'm very happy to talk about the work of our daring circle, Women for Health, which is a think tank, a task force that is active all along the year, and where our objective is to improve women's health and to explore unique ways to enhance their health status, but also quality of life. And based on the observation of gaps in women's access to health throughout their lives, this year we've decided to focus on the health of women at midlife. Because in this phase of their lives, women are hitting the peaks of their careers most of the time. But at the same time, they have to deal with many responsibilities such as childcare, aging relatives, and eventually menopause. All these aspects combined make this period a challenging point in women's life, one which is rarely addressed publicly. So in 2021, we can ask ourselves, what role can businesses and other organizations play collectively to support women's health at midlife, and especially in the light of the climate crisis, the care challenge, and the COVID recovery? I really think it's time for businesses and citizens to positively influence women's health and for organizations around the world to implement policies to better support women's health throughout their lives. So finally, I want to thank you all for being here today to discuss again such an important issue. And I want to thank warmly our partners, especially AXA, who is the leading partner of our Daring Circle Women for Health, for helping us to raise awareness on those inequalities and to commit to finding far-reaching solutions to empower women. Over to you, Shaili.
Thanks very much. You're going to put it more succinctly that if we look at women's health, how can we ignore it at a time when they are at the peaks of their careers? And there's so much more that they could contribute. Should we prioritize how they look at health at many levels? It's mental health, it's reproductive health, and so on. But I think one of the things that we often need to focus on, and even Audrey mentioned that, is that when you do go out there and support a woman's health at various levels, you're not just supporting her. You're not just helping out her ability to live a fulfilling life, but that of many communities, that of many other people in her villages, in their families, and also leading to better decisions about health overall for the larger women. Family or workplace and so on. That's really the critical focus that's coming through with the next discussion at the Women's Forum for Women for Health, where we talk about how to not take a piecemeal approach. How can we come up with reproductive mental health as well as, let's say, middle-age focus on health for women in a long-term way? How can these ambitions to have sustainable health solutions for women be taken to a policy table where the solutions are meaningful, long-term, and impactful? May I invite the moderator of the next session, Star Jones, to take over and steer this for us.
Thank you so much, Shaili. It's such a pleasure to talk about the topic that has been a front burner issue for me for now more than a decade. And it should be on the front burner for all women throughout our life cycle, which is what we will get into today. But as the national volunteer for the American Heart Association, women's heart health and all aspects of health have been my priority, my purpose, and my mission. And I am so honored to have the partners today who will join me in this discussion. As Audrey and Shaili so eloquently pointed out, today's health systems take a extremely piecemeal approach to women's health, from reproductive health to mental health to seniors' health. So we're looking at how we can develop long-term approaches to women's health that really do take into account social, behavioral, and policy drivers that will affect our health at every life stage. And who better to really try to get around this topic than the people that I have with me today. Let me first introduce you to Rosaline Koo, the founder of CXA. You'll learn a lot more about that in a moment. Alexis McGill Johnson, the CEO and president of Planned Parenthood Federation of America. Lisa Stevens, Chief People Officer for Aon. And Marie Teil, Global Head of the Women's Program for UCB Biopharma SRL. I just want to say hello to everyone. I'm so excited to be able to have this conversation with them, and I need to have someone help me set the table here. The session is going to be a conversation between our speakers and me. However, we're going to do a little bit of a fire starter, and I'm going to start with Alexis McGill Johnson, the CEO and president of Planned Parenthood Federation of America. Alexis, you lead Planned Parenthood, and as you know, I have a special relationship with Planned Parenthood because of my mom's immediate suggestion to me that this is where I learn how to be a woman. And so Planned Parenthood and I go way, way, way back. So you lead Planned Parenthood, the largest provider of sexual and reproductive health care in the United States. You provide services from STI testing and treatment to cancer screenings, to birth control, and of course, terminations. Most people think of the window for sexual and reproductive health as 18 to 34. I resent that very much, being a 60-year-old. But I've heard you talk about the road of our sexual and reproductive health from age 2 to 92. So that we can table set our discussion today on women's health throughout the life course, please share with us how you approach the life cycle of a patient and the ways in which Planned Parenthood is working to give people of all ages the tools to make decisions about their futures.
Thank you so much for that kind introduction, Star. And it's just wonderful to be here in this conversation with so many folks that I admire. Look, Planned Parenthood was founded more than 100 years ago with a really revolutionary notion that our body is our own. In the US, 1 in 5 women has been to Planned Parenthood in their lifetime. So your experience with your mother is one that so many young people experience with their parents, with their aunties, with their friends. And I think it is really, important that, we understand Planned Parenthood has 600 health centers. We serve patients all across the US and in the globe. We have 200 million people who come to our websites for accurate information and education every year. And we are actually a global organization. We call Backing the Brave is kind of our global brand. We work with providers and advocates and students and activists who are driving, really importantly, locally led movements, but we're ensuring that they are globally connected so that they can continue to fight in countries across Africa and Latin America to spark and sustain progress at the leading edge of the movement for sexual and reproductive health. So as I talk about the 2 to 92, often, I think what is most important about that is that at every stage of our lives, right, the fight for how we control our bodies, becoming a strong advocate for the work that we do is actually a lesson that we take on throughout our lives. We take it on as students, we take it on as parents, we take it on as workers, because sexual and reproductive health care is healthcare. And while in many countries it has been, including the US, atrociously politicized, creating the need to advocate. But that idea that having to learn to advocate for yourself, learning to show up unapologetically and authentically is something that stays with you, right? Throughout your career, the way in which you invest in your aspirations and your future, right? I talk about health equity as an ownership stake in your own life. And I think that is really what Planned Parenthood brings into this conversation. The way we advocate from everything for increasing access to birth control, which we know is responsible for 1/3 of women's wage increases since the 1960s. Like literally in the US, we have the pill to thank for 30% increase in our paychecks. Those are the kinds of things that allow us to continue to advocate. And that is why the work that I'm honored to do and to serve is so important.
Thank you so much, Alexis. And what you've done is you've said how our sexual and reproductive health throughout the life cycle touches so many areas of our lives, from our pocketbook to our, of course, our healthcare, to our education, every other industry that we are dealing with. And so I'd like to include the rest of our panel, now that Alexis has table set for us, to continue by giving us a taste of how they are moving through women's health throughout this life cycle. And I'm going to start with Marie. Marie Teil, again, is the global head of women's programming for UCB Biopharma. And Marie, Alexis just laid out the issues and the challenges and the concerns that women face regarding our sexual and reproductive health. So I know this is your area of expertise. What are some of the additional areas of healthcare that can be improved for women? And honestly, and here's a big one, what questions should women be asking of our healthcare providers so that we can walk in there forewarned and forearmed?
Thank you, Grace, for inviting me to this panel. And it's really an honor to be here. And good afternoon, everyone. So I just want to start by saying, yes, women face challenges during their reproductive health. And what can we do? So the way we tackle it at UCB, and at UCB, we are a global pharma company, as you mentioned. We are focusing on creating value for people living with chronic severe diseases. So we're talking here about epilepsy, we're talking about other neurological diseases, inflammatory diseases, lupus, all these diseases that you may be familiar with, where actually women during this time where they're starting thinking of having families, may be diagnosed and may be treated. And so what we want to do first is to improve evidence generation. I think that's the first thing we need to think about, because women, what should they ask their healthcare provider? It's actually, what data do you have? Tell me information. But where is this information? So let me tell you a little bit and set up the context here. Millions of women around the world are considering starting or expanding their families. Many of them suffer from chronic illnesses or may become sick during their pregnancy or during postpartum, a phase that we often forget and is so important for women as well. And therefore, they may need to use medicines during these times. As a matter of fact, data show that more than 80% of pregnant women take at least one medicine during their pregnancy or during breastfeeding. And it could be either prescribed medicine, but also over-the-counter and supplement. However, we know very little about these medications, and I'm sure you know that. When you have to take a drug and you look at what is information for pregnancy, the response is very often, actually 95% of the cases, there's limited information. That's what you find in the labels. Actually, only 5% of the medications have information in their label regarding pregnancy and breastfeeding. So why is that? And I think it's important to think of why. Well, first of all, and you mentioned that, Star or Audrey or Alexis, someone mentioned the fact that women are underrepresented in clinical research, and we know that. But in addition, when they become pregnant, they are excluded from clinical trials. And therefore, evidence generation is even more sparse for these patients, for these women. However, we know that controlling disease activity during pregnancy, making sure that whatever disease they have, whether it's an infection, whether it's a chronic disease, it's well controlled during this crucial time of their life, has indisputable health benefits to the mother, but also to the child. I'm sure you have all heard obstetricians saying healthy mother, healthy baby. It's something we've heard so many times. So we need to keep our mothers healthy. It's super, super important for their babies, for society in general. And to make these informed decisions, well, the question is, what should they do? How can we empower them to make these informed decisions? The first thing we need to do is to make this decision not based on the absence of science, but based on sound clinical information. And I think for us at UCB, we always say we need to protect women through research, not from research. And I think this is extremely important. So my pledge here is that we need to work together, and we will hopefully have that in the discussion, work together to see how we can improve this data generation and evidence generation for these patients.
Thank you so much, Maria. As a matter of fact, as I listen to you talk, all I could be reminded of is throughout this new normal of the living through and with this pandemic, the questions and concerns that pregnant women and women of childbearing age had about what they could take, shouldn't take, should take, when they can take it, and what, if anything, would occur to them, their bodies, and or their children was one of the biggest concerns. And as we talk a little bit about this new normal throughout our discussion, we will bring that back. Rosaline, it's interesting because you are the one that conceived of putting power back in the hands, not just of women, but women employees, women who are working and making decisions every single day about every aspect of their life. So now let's make some decisions about our healthcare. You believe that employees ourselves can shift company-funded health spends, so that's that money that the company puts out there for our healthcare, from treatment to prevention, stopping it before it happens. So explain, how does your platform enable women to take charge of this part of our health?
Yeah, so when I was running Mercer out here, one of my largest Chinese clients bought bought a lot of insurance from us, and then they told us, look, we've discovered too many employees with late stage cancers. It's really too late. So they asked the simple question, why can't someone connect the labs for early detection, all of the services for disease prevention and wellness in addition to insurance before it's too late? So that's what I did. I left my company and I spent all my family's savings to build this, because you have to move the money, right? Everyone talks about shifting the paradigm from treatment to prevention, but you have to shift the money. So if we could redeploy the money, we could use our spouses or our parents' insurance plans, but shift the money into maternity, because out here in Asia, maternity is not paid for by insurance, to pediatrics, to menopause. I mean, I'm postmenopausal. I didn't even know I had menopause. It just, dead, right, gone. Mental health, yoga, massage, screening, and all of the diseases that Marie's talking about. So it really is just shifting the money and connecting those providers and giving people access to that.
Rosaline, I have to tell you, for you to say that you didn't even know you were in menopause, you blessed person. Take it from someone who truly knows she is in menopause. I don't know why when women start talking about health, the first thing we do is start sharing. And speaking of that, I'm going to go to my friend and colleague, Lisa. Lisa, this is your turn. As Chief People Officer of Aon, this is the time when you just have to do what's best for your team. And you all have been really working so hard. As a matter of fact, Aon has been the firm and a leader that really stood out during the pandemic on working with firms worldwide on employee resiliency. And I know that word gets on people's nerves sometimes, because sometimes you just don't even want to be resilient, but employee resiliency and human sustainability. So why don't you give us that 30,000 feet view of what you've seen going on, not just inside your organization, but other organizations for best practices, and what you're doing for your colleagues on this topic in particular?
All right, Star, I'd love to do that. And I have to say, I love being with this entire group. And I have to share a secret, a personal secret, but I have this little remote. So when people see me hit it, it's because I'm getting hot and I can turn on an air conditioning.
So you're in my category. You know exactly what we're talking about.
The conversation's real right now. Let's just be real. So there's times when I just get hot and I just need some help. But let me just first start with the pandemic has done so much from an inclusive people leadership perspective for Aon. So I think back to March 2020 when we had the opportunity to do this right away. We had the foresight to know that we needed to connect from a virtual perspective. And so it opened up more conversations to more people around the globe than we ever could have done before. And when we think about our commitment to a one firm mindset, or to being passionate about each other and passionate about our clients, this opportunity to connect in a way when people were feeling isolated, it created some really good things for us as an organization, because it opened up the conversation for women in ways that had never happened before. And I hope that that's true for other firms and for other organizations and for other communities. So I want to say that that's been a big positive for us. It also opened up the conversation around mental health and around it. We can't hide from it anymore. When you think about COVID and you think about what COVID does to the body and how it maybe brings things out in you that were there, the pandemic forced us to deal with things that were there before, but that we now know we have to deal with. So as a firm, I would say one of the things that I'm most proud of is that the conversation is there. There's no stigma around us talking about mental wellness and how we're doing in ways that we hadn't done before. We'll talk about that more later. Resilience. Okay, I know we don't want to hear it. A good friend of ours, Rachel Fellows, coined this, so I don't want to take it from her. This is sisterhood right now at the best. Every single person who's listening right now has their story of what's happened over the last 18 months, what's happened in their lifetime. Star, I think about your story of what you've overcome from a heart health perspective, and the ability for us to be able to share those stories is so incredibly important. But we all have those stories. And when we think about sisterhood, we also need to think about resiliencehood, because resiliencehood is what's happening right now. It's all of us connecting to share our experiences, our stories on how to help our fellow women to be resilient. And again, we can spend more time on that later, but I want to make it a good word. I know it's a word that's that I think helix is the other one that people are sick of hearing, like, oh, we're going to have a helix meeting, or it's a helix environment. But that's not a bad word either, because it creates inclusion for more people to be in the conversation than they were before. So I'm really looking forward to continuing the conversation, Star and team.
Thank you, Lisa. And you are absolutely telling the truth. I actually was going to go there to these personal stories, because I think it's fair to say, for the most part, women's physical health and mental and emotional well-being are really just not being highlighted and emphasized enough. I see it as a front burner issue. You all see it as a front burner issue, but it's not a front burner issue for society. And health and the quest to be healthy is a touch point for every one of us. It touches us all. So I believe the only way to highlight it is to highlight it for all practical purposes. So I really want to ask how it has touched you and your family in a way that has made you a part of the we that Lisa so eloquently laid out, we in this sisterhood. For me, she mentioned I'm a heart disease survivor, and I like to say thriver. 11 years ago, I had full-blown open heart surgery. And I'm talking the kind where they crack your chest and your heart stops. And my heart was stopped for 22 minutes. They disconnected my heart. Don't worry, they put it back together. So I'm back doing okay. But it sort of gave me appreciation for the fact that heart disease is the #1 killer of women. And we don't look at it as a woman's disease. We look at it as an old guy's disease. And in reality, it kills more women than all forms of cancer combined. And so for me, the advocacy for making sure awareness turns into action is how it has affected me. It's become my purpose for waking up in the morning is to empower women to take control of their health. Alexis, I'll turn to you. What about you? What has health, how has health and the quest to be healthy impacted on you?
I really love this conversation, and particularly centering around maternity. I remember when I've always, been a fairly blessed person with respect to my health. When I had my first child, I was in the hospital, and I woke up in the middle of the night after a feeding to run to the restroom, and I passed out on the concrete floor. And I had been saying all along to the doctor something wasn't right, but I didn't know what it was. And it turns out I just was dehydrated, and I was in new mom state. But they kept shaming me. They kept saying, "You're fine. It's in your head," and in the very kind of gaslit way. And I didn't have a name for it until Serena Williams was talking about her experience, someone whose body has been so studied and so familiar with everything that could be going on. The way that she had to advocate for herself. And I think about that, living a life of relative privilege, being able to, have access to so many extraordinary medical providers, and yet still feeling the stigma, right? Still feeling the shame that I didn't know exactly what I was doing as a new mom. I didn't know exactly how to take care of myself, and how was I going to be responsible for another being. And I do think the ways in which sexual and reproductive health care from the very beginning, that's why I'm from 2 to 92, that we have to have these conversations and be more public about it, because it is important how we are teaching young people how to advocate for themselves. And then, to know I need a policy that is going to help me with postpartum coverage, to help me, with, engaging in the workforce differently. And then, I need to know about the remote control fan, their air conditioning, right? Those are the things that we have to share, because the basis of those personal stories actually do, when they are codified into policies and laws, that's actually what starts to make the difference. So I totally agree, moving the money we also have to move the laws in our places so that those are actually helping sustain the infrastructure that we need.
I love to take notes on what everybody is saying. Finance, moving the money, but also moving the laws. Absolutely. Oh, and don't forget the remote control fan. Got to put that in there no matter what. Marie, I'm going to come to you on the same topic. How's the quest to be healthy and to focus on your health impacted you? You're muted. You're muted.
So sorry. After all this time being virtual, I'm still unable to unmute myself. How is shame? Anyway, so I want to tell a story about why I came to that, why this all came to me. I'm a mother of 3, and of course, as most of us, the pregnancy didn't go exactly the way we wanted, and we had this ideal thing. But I want to talk about people I've met who were women who were sick. So I felt I was privileged to be healthy during my pregnancies. But actually, long time ago, I'm not going to talk about the remote control fan. But actually, as I was working in the US in an academic center, I met many women who became my friends who were sick and wanted to start a family. And why? Because there was a time where actually these women, some time ago, were told, you will never have a child. Don't even think about it, because you have such chronic diseases that it's not going to happen. And then I met these women, and they were treated early. They felt good. They wanted to have a family. They were getting married. They really wanted to have this experience and think about the future with their husband. And so I remember one of them in particular who was just very, very sick, managed to be well controlled on treatment, and came to many physicians in the US at a very high level academic hospital and asked whether she could be pregnant. And the answers she was getting were, no, you can't, or yes, you can, but you will have to stop your treatment, or I don't know. And this was all very disturbing. And I really felt for her, and I will always remember her. And I think when I was given the opportunity to work on that, I just want to say, she lost her first baby. She stopped her treatment, lost her first baby. She decided to try again. She continued her treatment, and she had a healthy pregnancy. She actually had 2 healthy pregnancies. So it was fantastic. The outcome was great. But I just want to say, when I was given the opportunity to work in that field, in the field of research, in the field of generating information, so that physicians would not say, I don't know, to their patients, oh, stop or continue, but I don't know, I cannot tell you more than that, then I felt I didn't hesitate. I just jumped into it and jumped from academia to industry to do that. I thought it was a unique and fantastic opportunity. So that's a little bit of my personal story around that.
That's a wonderful, wonderful story, mainly because what you're saying is, and Lisa, we'll steal that word that we are all getting tired of, resilience. She didn't take no for an answer. That woman did not take no for an answer, and she still sought the answers that would give her the result that she ultimately wanted. And again, that speaks to the sisterhood around having discussions about our own physical and mental health. And Lisa, I'm going to just come on over to you. We actually share a relationship as it relates to cardiac disease. We talked about that with our families. So how has the quest to be healthy and focus on your health impacted you?
So during the pandemic, we've been through three major heart surgeries, all of which I think went as well as they possibly could. However, I lost my mom in February. I will say that the gift that we were given was that my mom was with us from the start of the pandemic. And so I have 3 children, and my 3 children had to come home from college and got time with my mom that they never would have gotten and I know, again, this word resilience, it's hard, but I think back to when I was pregnant with all of my children, and I had 2 healthy pregnancies and 1 that wasn't. And my middle daughter was in and out of the hospital for about a year. And something that changed my life, and I think it does go to this, like, and I don't even think we were using the word resilience then at the time. I think, you think about gratitude and how do you use that muscle and all those things. But she was fed through a tube, and kidney disease, all sorts of different things. She's completely healthy today. She's fine today. So let me just start there. But as many of you know, once you have a child, when a child is sick, it can be very challenging. But a thing that really changed my life was we had to do a arterial draw blood from her, and my husband and I had no idea what that meant at the time. And so she'd been stuck as a baby over and over again. So hard finding the veins. There's much more risk with an arterial draw on a 5-month-old baby, and so once they found the vein after poking her and her crying and everything else, I was told by the nurse, now you need to go up and go back, and you're in the hospital now for the next 24 hours. I'm like, what? Why? And we've been in and out of the hospital. And I felt like I knew all the nurses up on the floor, and give a hug to every single doctor, nurse, healthcare provider out there, especially, all that they do. But so I was at my brink. I can remember getting on the elevator to go upstairs to the pediatric ward and thinking, I can't do this anymore. Like I just can't make it. Like, how am I going to get through this? And my husband had to leave to go take care of our other child. And when I got upstairs, and I'll have this in my mind for the rest of my life, as we were walking to the room, and it was the room we were always in, that we seemed to always get put into, I saw a mother and a father. And they were both sitting on a bed. And then there was a little girl in a nightgown with no hair, and she was kind of moving around and popping around. And the doctor was talking to the mom and dad, and they were crying. And I just remember that, and I'll never forget it, because it was a reminder to me and a hit in my stomach about perspective. I was upset about an arterial draw and having to be in the hospital for 24 hours. And yes, it had been, stressful. But I also gave me this perspective of that, as bad as I had it, that there were other people that had issues that were worse, and that I had a community of nurses, doctors, friends, family that were around me. And so fast forward to today, I just feel so incredibly grateful to be one part of an organization that absolutely understands that people, colleagues, employees, whatever you call them, are just as important as clients, and that without people, you can't take care of clients. And so to have this focus on, one, how do we help each other? How do we reach out to each other and support each other is so important. And organizations often are very, very good at helping with welcoming when good things go on for colleagues. So, the anniversary, when someone starts, when someone has a baby, when someone gets married. But we struggle with loss. We struggle with the challenges. And so the smarter we can become around that, regardless of where a woman is or a man is or anyone is in their life and their story, the better we'll be as firms. And that's why we have to have the conversations, and we have to allow people to be authentic and vulnerable and talk about these types of things, and help each other to be stronger, to get through whatever life throws us. Star 22 minutes.
Yeah. And let me be very clear, Lisa, very few things bother me anymore, because when they stop your heart for 22 minutes and they can start it back up, you figure the rest of it out, if you know what I mean. And I just thank you for the vulnerability that you just showed. I hear throughout our conversations, trying to make sure that you are not alone, or I should say, you need to know you're not alone. You're not just having this experience by yourself. There are other women, other families that are having similar experiences. And our ability to help each other through those experiences is really what makes that collective we that we've all been talking about. Rosaline, I'm going to come to you finally on this topic. How has the quest to be healthy and focus on your health impacted on you?
Yeah, so pre-COVID, my son's university in Boston called and asked Mrs. Koo, we know you're in Singapore, but we haven't seen your son for 3 months. So you can imagine how scary it is.
Wow.
So we couldn't track him down. I was running a startup. So my husband flew to Boston from Singapore and found out that my son made it to the library, but couldn't make it to school, right? So he just fell into a mental health rut. And we had no idea because we're on the other side of the world. So finally brought him back to Singapore, got him in counseling for a year, and just sent him back to Boston where his girlfriend can watch him. But she didn't even know, and his roommates didn't know. No one knew. The other story is when I was building a startup during the .com, and I was commuting to KL, my mother was here from Los Angeles, and she discovered that my daughter had epilepsy. We didn't know. This is the mother I am, right? Didn't know. And we found out it was triggering learning disorders. So I quit my job immediately. My husband didn't even think of quitting. I quit my job, immediately come home, right? We diagnosed her. We found out it was triggered by sleep deprivation because both her parents have regional roles and we're traveling all the time. So she was crying all the time. So finally got her diagnosed, sent her to the right school. She graduated from Tufts in computer science. She overcame it, right? Imagine that, right? She's 26 now. Of course, she just recovered from COVID too. But yeah, I'm healthy. I'm healthy, obviously ignorant, but healthy. But my kids, I worry about a lot.
That you're not allowed to say that because I'm going to tell you, for years and years and years, people always thought, okay, she's a smart one. She's the journalist. She's the researcher. I had no idea that heart disease impacted on women the way it does. None whatsoever. If I can tell the truth, I thought it was an old white guy's disease with a big cigar sitting at a steak restaurant. That's what I thought. And I was so wrong. And again, Marie was the first one to talk to us about data-driven information. We have to get into the research. We have to be led by the science. And we have to ask those questions. And so you get to forgive yourself for not knowing. But what we're proud of is your action immediately upon finding out that there were issues. And bravo to your son and to your daughter. I mean, and bravo to all of you ladies for being, that word, resilient through all of these health challenges. You know, Alexis, I want to get into what I like to call a rapid fire session because we're coming towards the back end of our time. But one of the things that has come up constantly has been living in the new normal, the COVID pandemic. Okay. And really what has happened is we've seen how throughout this pandemic, the disproportionate and unequal impact on women and our role in society. So in other words, COVID has just exacerbated what was already there. How have you seen it impact on women's health and wellness?
Look, I mean, I think the pre-pandemic women were already worldwide, were already taking on 2.5 times more the invisible labor, right? The care work of men, particularly women of color. And so that had clearly been exacerbated during the pandemic. And we have seen that very clear numbers, right? In workforce participation, you know, it is for women, it is the lowest number in 30 years. So we do have a lot to be concerned about with respect to what is happening. This isn't just like a great resignation because we want to change our jobs because it wasn't serving us. It's that literally the straw broke because we were holding up so much, and that this massive pandemic has impacted us in this way. And so I do think that, you know, coupling that with the frustration and the rage, you know, obviously in the US, what we are experiencing around many politicians who are using this pandemic and using this moment to include more restrictions around access to particularly abortion care in the U.S. And by the way, most women, many women who have abortion, I think it's about 60% are already moms, so they know what the decisions that they are making. I think it's that double edge of saying, we are all facing this crisis, and by the way, we don't necessarily trust you to make decisions about yourselves, and that kind of like at the core of the work that we need to do in this moment to ensure when we talk about equity, making sure that all of us, and particularly those who are most impacted, are centered in the conversations, so that we are building the right structures and strategies and policies to address them for sure. But the pandemic has particularly been rough for women of color.
Absolutely. And Marie, I have to, because this is something that you talk about constantly, is public policy. How does public policy need to change to serve women better?
Well, so it's public policy, definitely. And what I'm going to say, it's about research, it's about generation of data. Obviously, you said that as well. And we saw that definitely with COVID, with the pandemic. How do we treat these women who are pregnant, want to be pregnant? No data on them. It wasn't even part of the research. And they are the future. These new generations, they are building the new generation. So how do we help them? What can we do? So for me, there's definitely policymakers, of course, and there are already great things happening, and the field is moving. And I want to give some hope here, because in terms of generation of data, in terms of research, there are hope. People are now, the regulators are thinking about it. But I think it's all about partnership. It's all about collaboration. We at UCB, we're committed to empower women. That's what we want to do. We start all our programs with generating research in this subpopulation, really helping these women at this time of their life, providing information. But there's still a lot of work to do, and we cannot do it alone. So we also need, of course, the patients to say what they want, because they are at the key, at the center of what we do. So the women have to say what they want, and they have to voice it, but also the scientific communities have to raise their voice. And I see more and more of our key opinion leaders raising these questions, but also the regulators. The insurers, I'm linking to Lisa, the insurance, the policymakers, yes, we need to be stricter in what we're doing, and we need to be more forward thinking for the future of our generations. And I think this is really collaboration and partnership is the only way to make it.
And I'm going to get in with Lisa and Rosaline on this, because Rosaline, there's a tendency in the healthcare and insurance to be reactive rather than proactive in monitoring health issues. So how does filling a gap in early detection and prevention particularly serve women?
Well, we are the care burden, right? We are the caretakers. So it serves us if, all of our families don't catch these diseases. So we've been working to extract the data from the labs, the data from HR and age and gender and the lifestyle, and take all that data and even the claims diagnosis and the drugs, to take all that data and work with population health companies in collaboration to give recommendations on what is your care plan and pull all the services together. So Marie's right. It is about the collaboration and the partnerships, because it takes a village to fix healthcare.
100%. 100%. I mean, and Lisa, you're going to have to bring us full circle, because we've talked a lot about well-being and health and thriving. Anne's really been doing a lot to help employees with what you have called their full selves. Give us some best practices, because we're going to need to wrap this part up, sadly to say, but I always like to end with best practices.
All right, so here you go. So you've been spending a lot of time on human sustainability. All of us need it. So every single one of us, whoever you are, wherever you are, there's things that we all need to focus on, and we need to make sure we have these things and have them in check. So it's been mentioned, all these things have been mentioned, but our emotional health, our mental health, our physical health, our communities, our relationships, how we are in terms of competency and action, meaning and purpose. And so when we can tie those things together and we can see where our gaps are and where our opportunities are, that's where we can truly make the difference. And so I just ask all of you, again, who are out there, to really think about, how are you taking care of your whole self? And that is one thing with Aon. I get to be a client of Aon. And so we've been working on this Human Sustainability Index and really helping our colleagues with, and leaders with, where are our gaps, and then what do we need to do to help to support each other. And then the last thing I'll just say is, I know that on Saturday it was Global Kindness Day, but trying to start with kindness and with positive intent, especially on, Alexis, I think about the things that you talked about and where women are. Women are moving up in the C-suite. We know that for a fact. We've seen it in the last 18 months, but 1/3 of women are also thinking about taking a step down. That's not okay. We've got to keep having that conversation. We've got to keep pushing for tools, and we've got to keep supporting each other. Back to you, Star.
Back to me, but I'm actually going to turn it right back to you, because you each get 30 seconds to give me what we are saying here at the Women's Forum to address what we call the key closing question and call to action. How do you plan to use your collective power, or our collective power, sisters, with purpose for a more inclusive world? Marie, 30 seconds.
We are collaborating. What I'm going to do is continue working with patients, continue working with industry, with policymakers to improve how we generate data for these patients during this very, very special time of their life.
Okay, Rosaline, 30 seconds. What are you going to do?
So we used to work for corporates and employers. Now we're helping the insurers and all of their customers. So we're hoping to get to more countries and more insurers, so we have a bigger impact.
And I'm making my notes because I'm going to call you on this. Lisa, what are you going to do?
So we are going to keep having the conversation on mental wellness. We're going to keep helping our clients to have those conversations of rising resilience. I know that word's not popular, but we're going to keep doing that. And we are going to keep looking at how we build inclusive leadership skills for all, so that women are always at the table represented, not at 10%, not at 20%, but at 50%, because you know what? We make up more than half the population.
And we hold up half the sky. That's what everybody needs to remember. Alexis, you table sat for us. Close it down. What are you going to do, my sister?
Well, I'm going to be fighting a lot over the next year, certainly where we are in the U.S., but all across the globe, because it is so fundamental that if we lose our basic constitutional rights, our ability to make decisions about ourselves and our bodies, we don't get to be in the situation where we're actually having these conversations that we are today. And so that undergirds everything, our ability to just have our own sense of self-determination, our freedom, our imagination. That's what I'm going to keep fighting for with all of you.
And I am going to stay prepared for every opportunity to highlight women's health. Anytime we get a chance to put it on the front burner, to make it a part of the conversation, that means we highlight it, and when we highlight it, we can stir people to action. I thank you all so very much for your time today, and what a wonderful conversation about something that touches each and every one of us. I thank you again, and I send it back to Shelley and the team.